Something that many people don't really take into consideration is, family dynamics in terms of knowing certain diseases that are prone to your family. Because family history is a very strong risk factor for a lot of these chronic diseases like hypertension, diabetes, cancers. If you notice a trend in your family where, oh, I had an uncle who died of a stroke, I had an auntie who is taking high blood medication, or someone in my family has been taking diabetes medication since they were 30. It's already like that's like a sign for you to know that okay, it's like there's a pattern of these diseases in my family. So you as a young person, what you have to do is to now seek like professional guidance.
So now what I'm trying to understand now is that for you to break from this family curse, you have to pay attention to your health.
Yes, basically, the young people these days, Gen Zs, we are always out there partying. Yes, so you are taking a lot of alcohol. We are eating foods that are not like right. There's like more exposure to like smoking and all of that. So those things actually impact our health.
Wow.
And I think another thing is
Hello everyone, welcome to another episode of TooHealthTalk, a show where we get to break down each health challenges in a very simple and honest conversation. But before we continue today, please, if you want to know what we're doing here, please subscribe to this channel, like and share this video to someone that might need it. On today's episode, we have a very special guest with us today, Dr. Fasilah Yakubu. Welcome to the show, Doctor.
thank you for having me.
I'm so excited having you on the show, and as a young doctor, today's topic is a very special one. It's for young people like us, and going through this topic, I get to reflect on most of the things that have happened within the last 5 years in my life, both losing some friends and the way life has been in general, even in the news for like young people. So today's topic is why do young people fall sick these days, and why do people just get to like wake up and they're having different kind of sickness, they have been diagnosed with different kind of issues. So having to discuss this with a young doctor, so I think you're able to like relate more with Gen Z's and every one of us. So like I'm going to throw back this question to you openly now, that
Okay.
why do young people like us fall sick?
Okay. Generally, people fall sick, right? So I
But this
think
one is like critical illness. Assuming it's like malaria or typhoid, and that is
okay.
normal.
Yeah. So the question should be, why are we seeing chronic illnesses
Okay.
that were very peculiar to older people? Why are we seeing it now? So I think the reason for that is because now there is a lot of awareness concerning certain diseases, and over time we have gotten better at diagnosing diseases now in healthcare system. And there's also a shift in how life has been now compared to how it was before. So like in terms of like lifestyle, the food we eat, and the speed at which we are chasing the bag. Like you said, for Gen Zs, we are always like everybody is trying to do the next big thing.
True.
And we are focusing more on a lot of physical things, or we are pursuing life so much that we are forgetting to take care of ourselves. So that's why a lot of these like chronic illnesses are now like common among like young people these days.
Wow. So now for someone that is like in his 20s, I've
Yeah.
seen someone like in his 20s and is already having like hypertension.
Yeah.
And for me, I think hypertension is something we look out for when we are like in certain age. So why are we having that kind of chronic illnesses now?
Okay, so let me put it this way. So, like I said, our lifestyle has changed over time. So, young people are very into doing a lot of work that makes them not to take their health seriously. So, for example, you have people who do certain jobs that require them to sit all day. So you are working like a very hectic 9 to 5. You don't have time to eat properly. So you are depending on eating junks, fast food. So that means two major aspects of your health is already like shaky. One, you're not eating properly. And we know what food does to the body generally, because what you consume is going to determine your overall health. Secondly, you are sitting down for long hours. So that means there's reduced physical activities. in the past we had like our grandfathers, great grandfathers, they wake up in the morning, they'll go to the farm, they'll do like some work that requires them to burn calories, even if they are eating heavy meals. But now we are not doing that. So we are sitting down behind the decks for long. We are not eating well. So if your food is already something that it's no right, we're already looking at, okay, you're consuming high levels of sugar, you're taking a lot of fat, so cholesterol is getting high, sugar levels is getting high, and then there's stress, you are not sleeping well. These days we tend to bask in the idea of, oh, I can run on 4 hours of sleep because I'm doing this, that, but in the long run is not the best. So those like really, really important changes in our lifestyle is what's making it more prone to, young people like, getting sick
So
these
now
days.
I can say that like if a farmer will probably live longer than someone that works 9 to 5.
Well, not exactly, but because of the lack of physical activity, like I said, like people don't exercise as much as they should. It's not just about enrolling in the gym and going to lift like heavy weight. If you are doing all of that and you are still not eating right, if you are still consuming high amount of alcohol, okay, the young people these days, Gen Zs, we are always out there partying. Yes, so you are taking a lot of alcohol. We are eating foods that are not like right. There's like more exposure to like smoking and all of that. So those things actually impact our health.
Wow.
And I think another thing is, something that many people don't really take into consideration is, family dynamics in terms of knowing certain diseases that are prone to your families, because family history is a very strong risk factor for a lot of these chronic diseases like hypertension, diabetes, cancers. If you notice a trend in your family where, oh, I had an uncle who died of a stroke, I had an auntie who is taking high blood medication, or someone in my family has been taking diabetes medication since they were 30. It's already like that's like a sign for you to know that, okay, it's like there's a pattern of these diseases in my family. So you as a young person, what you have to do is to now seek like professional guidance. So you can speak to a doctor who will tell you, oh, if you already have this, that means you have a family history of this. So they will start guiding you early on how you can protect yourself from developing these illnesses now or much later.
Well,
So
so now you're talking about like family history.
yeah.
Like I grew up in Anambra first. I did my university days in Anambra, apart from like staying in Abuja most times. And I've seen people talk about, oh, when your family will die of accidents, so you should be like scared of dying in accidents. And I don't know if it's the same thing with like people. For example, now if your grandparents have like diabetes, there's like you said now, there's like possibility of you having diabetes.
Yeah.
Like, is there any way to like break through from would I say family curse? Just the way if you're going to church and say any family curse that's followed me, I cast that ban, because it's actually the same thing now in medicine.
Yeah. Yeah.
So is there any way to cast and ban that?
And so that's why you knowing what you're at risk of is like the first step towards having a healthy life. So for example, you know that, okay, let me use the most common one, which is hypertension.
Yeah.
So you have like a lot of family members who are being treated based on the fact that they have like high blood pressure. So hypertension is something that is predominant in your family. So you will now have to like ask yourself, okay, how can I prevent falling into this category? So hypertension, a lot of things that will make you be at risk apart from the family history is
Yeah.
also like, your lifestyle. That's why you tell some people that, okay, you have to start doing a lot of exercises, like you have to like move your body, because moving your body sounds like, oh, something that we just say, but it actually does a lot. Now, what kind of food are you eating? Are you always taking like junks? Like, are you always taking like sugary drinks? You can't know that you are at risk of developing something like that and you're not paying attention to your food. Because cholesterol is another thing that can, predispose you to having hypertension. So that means you cannot be eating a lot of food that have like high fat content. So watching out for these things that will make you even develop this condition faster is the only way that you can break the cause per se. So that's like the best way. And then knowing your numbers. I always tell my patients, like, you don't have to wait until you are sick before you go to the hospital. So if you already have an idea that, oh, in my family we have like history of hypertension, so that means you have to regularly check your blood pressure. You know what is normal for you, so that if you are seeing a value that is high, you know that, okay, I need to speak to a health professional, right? And then once you just ask questions, there are ways that you'll be guided through on how to prevent developing, these chronic
So
illnesses.
now what I'm trying to understand now is that for you to break from this family curse, you have to pay attention to your health.
Yes, basically you have to. You don't wait until you are sick before you move to the hospital. So that's the problem that we are facing now. Like it still all goes back to how we are so focused on chasing the bag. I'm not against chasing the bag, but you also have to make sure that when the bag comes, you are healthy enough to enjoy what's in the bag. So okay, let me give an example. When you're using your phone and your battery is, you can see that it's becoming low, you don't wait for it to run out before you plug it, right? So it's the same way. You don't wait for your body to deteriorate. Like a lot of times we just wait until it's so bad or somebody has to force you
Yeah.
before you know that, okay, I should seek medical attention. So you don't have to be sick. Like just take preventive measures basically to make yourself, healthy. That's just the
So now
secret.
I just remembered something now. So there's someone I know that the grandparents had like this is it diabetes foot leg and stuff like that. So like the person died of it, and another of the great grandparents, I mean the great grandparents had died of diabetes foot leg. Another one, the grandparents is having that same issue, and they're saying, oh, it's like cause something like that. And if you come to look at it now, that okay, now that things are already advanced, people already like check family history, do like these checks, and people won't get to like have these things and just
Yeah.
place it in religion that, oh, it's family cause, or oh, your family used to have this stuff, so you've been caused. So getting this like having this conversation with you now, I think is going to open more people eyes to, it's like, okay, your family is not really cost. It's just, you just have to like pay attention to your health and your family history. So now also you talked about like most of the patients you see and how you're able to like advise them. Now for hypertension, like, or for any other like diseases, how do you handle people from like 20s to 30s that are having this kind of chronic illness?
Okay, so it's usually very heartbreaking when you have to break certain news to young people. Like if I'm telling someone that, oh, with everything that we are seeing, it seems like you have type 2 diabetes or you
Wow.
have like hypertension. So it's there's always this initial stage of denial, like, no, I'm 23, I'm 24, I can't have that. So it's usually very heartbreaking, but you just have to be able to walk them through it because, I mean, it's not something they are expecting. So when you now tell them, there's always this, oh, I can't believe it. But in reality, is what we are seeing. Like young people are having this kind of illness. So what we just do as healthcare professionals is just to, walk them through it. Like tell them that, okay, these are conditions that are very manageable, things that we can, take care of as long as you are following, like, what we're asking you to do. It doesn't necessarily mean it's the end of the world. It doesn't mean you're cursed or that you're not going to live long, because we have people who have been diagnosed of these illnesses from like a very young age, but they're able to manage it. So it's all about the management and just doing the appropriate, like, lifestyle adjustment. But the issue with young people these days is once you hear that you have something like hypertension, they don't want to believe it because there's this idea that once you have hypertension, you'll be taking medications for the rest of your life. Though there's some people that fall into that category, but there are some people who come, like they present very early. We can see that, okay, they're having like high numbers. We can do what we call like lifestyle modification, which is like a non-pharmacological approach. So like, okay, what about your lifestyle do we need to modify? Okay, what are you eating? How are you sleeping? What's your stress level? For some people, when they're able to make that, like, correct lifestyle adjustment, they just keep monitoring. They might not necessarily have to immediately start, medications and be on it for the rest of their life. Because that's the fear a lot of young people have. Like, I'm too young to start popping pills. I don't want to be someone that they always see with like a pill bag and all of that. So they tend to run. But if you don't face the problem, you would not be able to solve it. So accept it, ask questions. What can I do? How can I improve? How can I get better? And you just move on with life, like, it's nothing. It doesn't have to stop you from like accomplishing your dreams or still chasing the bag. There should just be like moderation. So
Now, which conditions do you see more often around like 20 to 30 years old people?
I think the most common one we are seeing these days, like, the hypertension.
So we are not sleeping, true, true.
Exactly. So that's the thing. And you always see young people say, me, I don't sleep, 3 hours of sleep in a day and I'm okay.
What's the
And
youngest you've seen?
okay, in order not to disclose too much, let's just say young. Like, you have like really young people, like, people that you wouldn't expect to have in like their late, like early 20s, like 25,
25 is
26.
hypertensive.
Exactly.
Wow.
So, yeah, so there are a lot of things that are contributing to it. Mostly stress. Like, people underrate the effect of stress. Like, people have no idea how bad stress can be. Like, it's not just an emotional feeling, oh, I'm feeling stressed. It can affect you and even translate to physical symptoms. Yeah, because
Wow.
if you're not sleeping properly, you're not allowing your body time to relax, shut down, and take a break, and all of that. You're always on the move. You are making your heart work way more than it should, and you are not even feeding it with the right kind of food. So it just doesn't work or balance itself out. That's why we have, like, this problem. So that's just like the major factor that is being that we are seeing now that is contributing to, young people having this, like what we eat, how we are moving, the stress levels, and just, I mean, it's good to have a carefree life sometimes, but don't just ignore the things that are important, because at the end of the day, you want to actually live healthy, not
Yeah,
just
true.
live. Yeah.
What
So.
about diabetes? How long, like, which age range do you see for the youngest for diabetes?
I know that, like, we have type 1 diabetes that, is predominant in young people, but type 2 used to be like among the older people. But these days we're
I think
having
I saw
like,
one post. Someone was talking about having type 2 diabetes. I saw one post like yesterday.
yeah.
A lady was saying she's diagnosed with type 2 diabetes. I was like, wow, at this very young age.
Yes, like, for them, there are some people that, genetically they are already like predisposed to having it, and
Wow.
yeah, so there are like certain metabolic conditions that people have as well that, predisposes them to having like type 2 diabetes. So as long as you are able to manage it properly, it doesn't have to stop you. So, and another thing is, it's not just now that young people are beginning to have these diseases. Actually, it's just because there's more awareness. We're talking about it more. People are
Oh,
presenting themselves to the hospital more. So that's why the statistics is coming up now. Yeah, so before,
okay.
people didn't really like going to the hospital, they won't show up, or people didn't even know what they are showing up for. So when we have like avenues like this, programs like this, that is telling you that, oh, this can happen in young people. So people will like do their research and like, oh, I've been feeling this type of way, and then they go to the hospital, and then you find out that, okay, you have this. Because some people don't necessarily come in for that condition. Someone can just come to the hospital, doctor, I've been having headache for like 2 weeks, I don't know what's going on. So we try to do like some background checks. Okay, what is it? What has happened? Any stress? Okay, let's do like some baseline investigations, and then in that instance, you now find that, oh, some numbers are not the way they should be, and that's how we now come up with diagnosis. Or someone who needs to do like a pre-employment medical report kind
Yeah.
of thing. Yeah, so you're just going for those normal checks, and in there you are told that, oh, this is not the way it's supposed to be. So we just pick it up from there. So that's why, the numbers are more now, because, there's more awareness
I
towards
saw
that.
one post on Twitter. Someone was saying that in the next 20 years, doctors are going to be billionaires because there's going to be a lot of like issues with the human body, like that we youths like we're not even taking care of our health. Do you think that's true?
Yeah, well, That question, saying it that way, like doctors will be billionaires, is almost looking as if we are praying for people to be sick. It's not. I won't equate it to
Yeah,
that.
but it's not you guys' fault now. People are not taking care of their health now.
So that's why we are trying to create more awareness. That's why we are trying to talk to people about like their health. Like it's very important that the information about health gets to people a lot, because the more you know, the better prepared you can be for whatever is to come. Do you understand? So,
True.
but even though people still have the information and they are still not using it, but at least we are seeing a bit of improvement, because if people actually do take charge fully, that's it might not actually things might get better in the next 20 years. Okay, now for example, we see more people actually saying they want to take their diet seriously. So we have a lot of meal plans here and there, how
True.
to lose weight. You see a lot of gyms are springing up here and there. People are having like fitness classes, people are doing Pilates, a lot of people are becoming more aware of what it is. Like people are seeing the dangers of smoking, people are seeing the dangers of consuming alcohol, people are seeing the dangers of eating overly processed foods. Do you understand? You see more people saying, oh, I plant my own like herbs myself, I like to do gardening. So there are improvements, I must say, and I feel like if people continue like that, we might be experiencing better health
Oh.
than actually going down from there. So let's be positive and
Yeah,
not,
let's be
yeah.
positive. So now for hypertension, can it be cured? Like, just after you've done like all the things you're asked, maybe in the
You
next,
you
can
want
it be cured?
to you want to set me up so that somebody will come and reference to this video. That was how that doctor said. No, you can manage hypertension. You
So
can actually manage it,
so once
right?
you're diagnosed with hypertension, like there's no going back.
It's not like there is no going back. It all has to do with how you actually manage it. If you don't take out certain things that are predisposing you to having that hypertension, where are we going to, like, there's no magic, there's no miracle that's going to stop it from not progressing.
Oh,
So it's the management and how you are taking care of yourself that plays a role
oh,
into the entire thing. Like I said, someone can be experiencing headache now for like every day for like a week, and then they go to the hospital and they are telling them, "Oh, your blood pressure is actually very high." And then they sit down and they reflect, "Oh, I've been so busy. I have deadlines, this, that," and they're able to like cut back on their stress, and they're able to like start jogging 15 minutes every day. They're able to take out like sugary drinks. They're able to take out like high carbohydrate diets that they are consuming, take out like deeply fried food, like just make like conscious effort towards wanting to have a better health. And we tell them, okay, monitor your blood pressure, see, come back for follow up, for checkup, let's see. And with time they are able to like adjust. Do you understand? So that kind of person is already aware that, okay, when I expose myself to stress or do this, that, I'm at risk of developing this. So they're able to like monitor and watch out for those things. So yeah, that's why I said the management. I won't allow you set me up so that nobody will reference to this video tomorrow. But yeah, that's it.
so what about stroke? I see young people now having stroke. What's the cause?
So it all still boils down to something like hypertension, for example. It's one of
Oh,
like the leading cause of
stroke.
stroke. So once your blood pressure is high, you are hypertensive and you are not doing anything to control that, you are at risk of developing stroke.
Wow.
Do you understand? Yeah.
Yeah.
So it's not something that just comes just like that. It's not something that you just wake up. Your body has been going through something, or people that are not, you don't have a healthy weight, for example, and you're still consuming a lot of food that are high in cholesterol, you are also going to be at risk of developing a stroke. Do you understand? So yeah. So these diseases are now being seen in young people. Of course, stroke will also be seen in young people because these are the things that will predispose you to having stroke. It's like a complication of these diseases. Do you
Oh,
understand?
yeah.
Yeah. So that's why we see like, oh, people in their 20s or in their early 30s being diagnosed with a stroke. It all boils down to having hypertension or uncontrolled diabetes or having like high cholesterol levels. So
So now, I noticed that we young ones, we only pay attention to infectious diseases like HIV or any sexually transmitted disease because I think that's where most people focus now. So now, if I want to compare now between lifestyle diseases and infectious diseases, which one is more dangerous?
I won't really say which one is more dangerous because it's like in the healthcare system, we are like, it's a constant battle with both. The infectious diseases are there, the lifestyle diseases are there. So we are just trying to make sure that, okay, we are able to handle these things properly because we cannot say oh infectious diseases are not so bad or lifestyle diseases are not so bad because nobody thought lifestyle disease would be something that would be affecting most of the population, but here we are today. So that's why we see a lot of health talks. We see a lot of people being out there talking about preventive medicine and trying to do things that would avoid those lifestyle diseases. So it's a battle against both actually
So now, if
right
you're
now.
battling, you just be focusing in both because I see people battle that okay, I'll take care of the infectious diseases more, and maybe if I want to like have sex, you must use condom or you must take all the vaccine, but you won't see them like living a proper lifestyle. So you're saying now for you to like live generally, you must take your lifestyle health
Yeah,
serious and
yeah. So it's you have to balance it out. So now that there's more awareness, people are talking about it more. So I mean, in terms of infectious disease, people will tell you, okay, they do this, they don't like they take preventive measures, right? But now they're also aware that okay, aside from that one self, there are also other things that you also have to pay attention to. So like what you are eating and what kind of activities you are involved in. So yeah.
So what about energy drink? We see a lot of young people these days now consume energy drink because of the kind of work we do. Okay, you want to like work for hours, you have to take energy drink. What is the implication of this energy drink that we consume that keeps us like active?
Okay, so energy drinks are if it's something okay, one thing about what we eat is if it's or that we drink, if it's something you take once in a while, it's okay. But when you constantly take these things over time, that's where the damage happens. So energy drinks, for example, they contain caffeine and they contain a lot of sugar. And now we are saying that too much refined sugar is not good because we are worried about developing diabetes. And caffeine is it's a stimulant. So a lot of people when they take energy drinks, for example, they'll tell you, they are very active, they can stay up all night. So maybe you're able to take it and then it keeps you up for like 2 hours and then abuse now steps in. You now start taking 3, 4, 5. So you are overstimulating yourself. You are too hyper. So your body doesn't even get to relax. So you are not sleeping. All because you want to meet up with something. If it's something that I say, oh, you just take energy drink because you like it just once in a while, okay. But when it becomes like a lifestyle, some people now they'll tell you, if they don't take I'm not really sure of the names, bullet
Please don't
or
call any name before they come for anybody here.
if they don't take certain energy drinks, they can't function. Like they can't do the work that they're supposed to do. So it now becomes like an addiction. And we all know how addiction can be. It's not only the regular things that we know
Yeah.
that people get addicted to, but things like energy drinks or all these like sugary drinks, people do get addicted to them. Like they can't eat if they don't take this, or
Well,
they can't walk if they don't drink this. You understand? So yeah, it's not. And then people now start mixing different cocktail.
yeah.
Exactly.
Wait, so that cocktail now, I mean, I see it as maybe it's actually very dangerous. Like us doing so many mixing, and now this mixing that we do now, we don't even know the measurements, the level of okay, this is on so level. You're
Yeah.
just like mixing, and we'll just drink it. I don't know. Sometimes, like most of the things, if I eat wrong now, I just feel somehow. I don't know, maybe because of the information I have now. If I just eat this kind of food I'll eat, I'll be like, "Ah, God, hope I've not eaten wrong. Hope this one."
You see, you have the information. That's why you are able to like subconsciously, you're even aware of, oh, am I doing the right thing? Yeah. So that information is power. The more people know, the more better aware they are of what to look out for, what not to do. So yeah, that's
Poor sleep, like how does like poor sleeping destroy the body, and how does better sleeping help the body?
if you don't sleep, what happens?
I have constant headache.
And when you sleep, what happens?
Like I'm chill.
Exactly. So sleep is it's not something that you have to wait until you've achieved what you think you need to achieve. So we see sleep as a reward, which is wrong. It's a
Oh,
necessity. You need to sleep. You need to rest. At least we're looking at having like a minimum of 6 hours of sleep every
six
night.
hours of sleep.
Yeah,
These days, people have 6 hours of sleep.
people don't. So people are not sleeping. People are not resting, and it's not a healthy way to live. If it's something that happens maybe once in a while, it's okay. But it has become like a lifestyle trend of people not slowing down, not resting, not sleeping. So they come back and they're having like severe headache. Even your
Oh,
productivity level at some point is going to actually slow down because you're not resting. There's so much the body can do.
true.
Do you understand? Yeah. So, well, Nigerians will say, "Poor man no dey sleep,"
True, true. Poor man, but
but that's not good. You need to rest.
whoa. So now, if you did not sleep now for 6 hours, now you are liable to die young.
Oh, oh, I didn't say. I didn't say that. No, you are not liable to die young, but don't make it a pattern whereby you're not resting. That's just my point. No,
Oh,
sometimes some things will happen that you're not able to like achieve that. But you also have to make a conscious effort about, oh, I've not really slept well this week. Maybe I'll try and take out time during the weekend or something to slow down, relax. But sometimes you might not have been able to. I mean, night sleep is actually good, very important. But sometimes you just say, oh, maybe I had so much to do, I couldn't sleep. Maybe during the day you have a free time. You can just get like a power nap, just somehow trying to maybe pay back your body what you owe it. Do you understand? Yeah. So
so now I've seen some doctors like they will advise you, oh, sleep well, and those doctors they to sleep. Now, what's the advice for
this
your own colleague?
show, this show, you are just setting me up. Well, I can't say much about that because it's all in the bid to take care of, people. But we try to.
But at least you should take care of yourself too more now.
But you come to the hospital at 1 a.m., 2 a.m. Someone has to see you. So that's why, I mean, not something that, anyway, just forget. Let's not go into that. Let's not go into that. So, yeah.
So now, for I've seen also someone talking about how like young ones use their phones, and it's probably going to affect them. Like there's so many pressure in social media. So many Nigerians are getting depressed also. Now, for young ones now that are depressed, that like have anxiety, like what's your like advice for them?
Well, my advice would be to slow down. Like, life is not as fast as you see it. You just have to realize that, it's how do I put it? Like, it's one step at a time. So there's so much pressure that we put on ourselves as young people. You want to achieve this, you want to attain this, but it doesn't work that way. All the people that we say, oh, they are so wealthy, they are so rich, they are so rich, it didn't just come up overnight. They put in a lot of work. So it's
Oh,
just a matter of you just, talking to yourself, like be self-aware of the realities of life, not getting carried away by what you see on social media. Do you understand? Yeah.
yeah.
So the less pressure you put on yourself, the more likely you won't be depressed. Or I mean, depression comes from other things. I mean, there are other like clinical reasons why people do get depressed. Do you understand? But in terms of like social media pressure and all of that, it's not worth it. I beg.
So now these days people talk about like self medication, like getting like diagnosis from AI, from Google and stuff like that. Like what is the implication of like self medication? Mostly from young ones these days, you just see them chatting AI that, oh, I'm having this. Is they don't really want to talk to the doctor. They just want to like ask AI and stuff like that. So what's your advice for them?
So the thing is, self-medication is never right. You understand? Like, I mean, you can be stressed, you have a headache, you can take paracetamol. Do you understand? But
Yeah.
if something you are doing all the time, you need to have it checked out. But somebody will not tell you, no, me, I used this, go and try this. So you see people sharing prescriptions. Like, yeah, because you can have headache, I can have headache, but what works for you might not work for me.
True.
So it's not a one size fits all. So that's where self medication comes in. Like the thing that you think might actually work
Right.
might not work. Do you understand? And the problem about relying on AI is AI is going to work with the information that you give it. So you say, oh, I'm having headache, what can I do? It will just maybe give you like some prompts, give you a little bit of scare, and then just give you like some options of what to take. But when you go to the hospital, because we have been trained on how to handle patient care, we know the questions to ask. Do you
Oh,
understand? So
yeah.
based on the question that you are asking, I can now determine where is the source of this headache. Is this something that will require you to do a scan or not? But sometimes people can tell you it's brain tumor and you are screaming, you are panicking. Some people would
True.
even go. I've seen patients who have gone, done MRI before coming to the hospital.
Wow. Don't
And when
ever.
you ask them questions, you realize you didn't even need to do an MRI
Oh,
because it's not every headache that you need to do a scan for, but you've gone to ask AI and AI has allowed you to spend your money. So yeah,
true.
that's just why self-medicating is usually not the best. Like,
So
but people
now,
are scared of coming to the hospital, which I understand anyway. But yeah,
do you think it's a particular reason for people being scared coming to the hospital?
some people have PTSD. Some people believe like the healthcare system has failed them, so they rather not. Some people are so busy they don't have that time because sometimes you go to the hospital, there's like long queue and all of that. So some people might not have like very close access to getting like proper healthcare. So there are quite a number of reasons why, but notwithstanding, it's still not an excuse to self-medicate.
Okay.
Like still get the proper help. Or the way people every time they have like cough and catarrh, they straight to antibiotics. People even know antibiotics at the tips of their finger, but it might just be a viral infection that we outgrow its course. You just need to take water, hydrate, vitamin C, and you're fine. But you've popped antibiotic pills, and
I think people don't really know how bad taking antibiotic is.
yeah, they don't know. So one of the major public health challenge we're having now is antibiotic resistance, which is like a serious problem. And it starts from people taking antibiotics when they shouldn't take it, or you've been prescribed antibiotics and you didn't complete it. So you expose yourself to getting resistant to these antibiotics. And when you now actually need it, it doesn't now work for you. And then we have a problem. So that's why people just need to just stop it. Like,
So how does this? Oh, you do not complete your antibiotic dosage. How and how is it bad? How does it work?
so you have an infection. We've been able to establish that it's a bacterial infection. So we're giving you an antibiotics. Antibiotics are very strong. They're very powerful. That's why when you have tonsillitis, for example, like an infection here that is caused by a bacteria, sometimes it can be viral, but yours has been seen to have been caused by a bacteria. So you are started on the course of antibiotics that can tackle that particular infection. So because this antibiotics is very strong, 2 days after taking it, the initial symptom you had, you're not having it again. You feel like, oh, you're okay, you're fine. That's what makes some people to stop. But no, don't stop. Complete it. Because the work that it has started allow you to be able to finish it and get rid of the bacteria completely. Don't give the bacteria an opportunity to fight against or to understand the pattern and how to now fight back and now become resistant to that particular antibiotic. So that's where the problem comes from. Like you've been given, they said 5 days, complete it. 7 days, complete it. Even if you get better, finish it. You are doing
Oh,
yourself more good by completing it as opposed to stopping halfway. So people, this is what they do when they have it. After 2 days of feeling better, they stop. If it comes back, they will not go and continue. It doesn't work like that. Just finish it. It's always
oh.
better like that.
So now, you've talked about routine check and how oh, checking your body is like good. So now, for men, what's the proper age for to start going for routine check? For women, what's also the proper age for to start going for routine check?
Okay. I wouldn't exactly give like a number, but like I said, do these checks as early as possible.
Like from which age range?
And once you're in your 20s, if you go to the hospital, based on the information that you give us, we'll be able to tell you, okay, this is what you can do.
So now you're advising someone that's like 20 years old to start going for routine check.
So, if, for example, you have a family history of maybe diabetes or you have a family history of certain cancers, do you understand? When you go to the hospital and say you want to do like a health check, your doctor will be able to know, okay, which is going to be important. You're not going to be made to do everything. Do you understand? So, it all boils down to the age at the time, the sex, family history, and the things that you are predisposed to. Do you understand here? So that's what we have, like some basic baseline, like investigations that you can do from time to time. But as you grow older, there are some more things that will put into those routine checks that you should do. Do you understand?
Yeah, because I've seen like someone in their 20s, they are saying that, oh, why would I go for a health check?
Well,
Because they are feeling strong and active.
yeah, so that's the thing. The whole idea is not to wait until you are not feeling strong and active before you go. Do you understand? Okay, let's say for example now, I use glasses, right? So if I started using glasses from the age of 11, for example,
Yeah,
it means part of my routine check will be having my eyes checked.
true.
For someone like you, if you've not had any issues with your eyes, you might not necessarily have to start checking your eyes very early. I don't know if you understand my
Yeah,
point. Yeah, so
true.
that's what I'm saying. It depends on the state of the patient at the time, and other questions that you will be asked that will help us to be able to streamline what to do. Because if you are someone that, okay, maybe from a young age you've had diabetes, and we know that diabetes can affect the eyes, from time to time we are going to be doing that screening for you. So that's why when you come to the hospital, if a 20-year-old comes to me
Yeah.
and say, oh, I've heard that it's good to have our health check, I want to do a full health check, I will sit him down, ask some questions. So based on the questions that I've asked him, I will now be able to know, okay, what should someone like him in particular, what should be his own check?
Okay.
Yeah.
So now, what's that one medical warning sign that people get to ignore?
So I think a lot of the time headaches are something that people get. I mean, you can have headache like when you are stressed, but sometimes if you are having like a particular kind of headache that you have not felt before, it's something that is a warning sign. Your body is telling you a sign. Because when you ask some people, they'll tell you, I've been feeling this very terrible headache that I've never felt before, but I thought it would go.
Oh,
But sometimes it doesn't go and then it becomes something, yeah. Or if you have like chest pain that you know it's not normal. Do you understand? They're just different things that you'll be able to pick up. Like if you are, let's say you have food poisoning, for example, but you've been vomiting for 3, 4 days. You know that's not normal anymore. That you need to get checked, or you go to the bathroom every day and it's normal, but these days you are struggling or you are seeing blood or something. And so there are signs that you would see that you know that is not part of your normal routine every day. Then you should have it checked.
so now for before we go, for every young Nigerian watching this video now, what's one sentence or one word that you want them to remember after watching this video?
So what I want them to remember is to know that your health is your priority. It's how you take care of your health. That's how you're going to end up living. So don't wait for when you are so sick before you have yourself checked. And don't be afraid of the hospital. It's not such a bad place. It's not such a bad place,
If I
actually.
wasn't working here, I'll probably be afraid of the hospital.
Well, I understand, but at the end of the day, it's a necessity sometimes if you have to just come.
So
Yeah.
now, general overview before we go. Do you have any like advice, for
Well,
anyone
we've
watching?
talked about everything. So everything still boils down to taking your health seriously and watch what you eat and stress. Like young people need to slow down because that Ferrari that you want to buy, you want to be strong enough to ride it.
True.
Let your net of kin not go and be the one that will end up driving the Ferrari. So yeah, honestly, just like slow down. I just think it's important to slow down. We all get stressed from time to time, but
True.
yeah,
So you've had it from doctor herself. Please slow down, because we'll surely get there. Like I've seen a lot of people, like they walk back to back, and some of us get to live to eat the fruit of our labor. Some of us don't get to live to eat the fruit of our labor. I believe for the for us to do the ones that is in our hand and leave the rest for God. I
yeah,
believe we should just take care of ourselves very well. Listen to our doctor's advice and sleep well,
yeah,
so that like you said, our next of kin will not will not eat our husband and stuff like that. So
yeah.
thank you so much, doctor, for coming on the show,
Thank you for
and
having me.
thank you for sharing your insights. I
Thank
believe a
you.
lot of us will learn. A lot of us start sleeping. A lot of us start taking walks. Exercising and
Yeah,
doing
drink
your
water.
everything. Which I'll try out. Start drinking a lot of water too.
Yeah.
So thank you so much for watching up to this moment. But before we go, please subscribe to this channel, share this video to someone that might need it, and you can drop your comments and comment section, your thoughts, and see you on our next episode. Bye.